la coalition Poids et TRANSNUT. Donc, il nous fait plaisir d'accueillir Dr. Fabio Gomes de l'Organisation panaméricaine de la santé. Fabio est un ami, un collègue de longue date. Il est nutritionniste de formation. Il est né au Brésil. Fabio a fait un doctorat en santé publique à l'Université de Rio de Janeiro. Il a travaillé plusieurs années au ministère de la Santé au Brésil, entre autres à l'Institut national du cancer, à développer des politiques publiques et des actions multisectorielles pour adresser la malnutrition. Et donc, il est maintenant aviseur régional depuis quelques années en alimentation et activité physique pour l'Organisation panaméricaine de la santé dans les Amériques. Et qu'est-ce que cette organisation fait? En fait, son rôle, c'est d'appuyer, de soutenir et de conseiller les gouvernements dans le développement de politiques publiques saines et durables. Donc, aujourd'hui, Fabio va nous donner un portrait de l'évolution des politiques visant à protéger l'alimentation, les systèmes alimentaires et la santé publique dans les Amériques. On sait aujourd'hui que tous les gouvernements du monde luttent contre deux grands enjeux. Donc, le premier, ce sont les changements climatiques. L'autre, c'est la malnutrition sous toutes ses formes. Et on reconnaît que pour adresser ces enjeux, on doit transformer nos systèmes alimentaires afin qu'ils soient plus durables et sains. Et l'OMS reconnaît le rôle clé des politiques publiques dans cette transformation. Et dans les Amériques, surtout en Amérique latine, on a vu le développement de politiques très innovantes, très intéressantes, qui peuvent nous influencer, peuvent nous inspirer ici au Canada. Donc, on est très fiers et contents d'accueillir Fabio Gomes ici au CReSP. Et juste pour souligner, donc, notre travail à TRANSNUT, c'est d'appuyer, de travailler avec l'OPS dans la réalisation de son mandat. Alors, sans plus tarder, je passe la parole à Fabio. Bem-vindo aqui, muito obrigado.
Obrigado.
E a palavra é você.
Muito obrigado. Merci beaucoup. Bonjour à tous. Je suis désolé qu'il n'ait pas continué en français, and I'll switch to English. And I hope that maybe next year, in 2 years, I can come back and make this presentation in French. I'll keep working on it. It's a really a great pleasure to be here. So I'll move quickly because as the topic indicates, we're sort of trying to change the whole Americas and with the work that we're doing in terms of how we're protecting and helping to protect healthy diets, food systems, and public health in the Americas. So I'm going to focus on the great elements and most important policies that we need to put in place to get that to happen. And starting with the context in terms of the impact on health and going beyond health and going beyond deaths. We know that in the Americas, just high blood glucose, hypertension, overweight, and obesity already kill almost half of the population in the entire region. But going beyond that, we'll see that just in 2019, we lost for those three risk factors, almost 3 million years of quality of life that we lost just in that year. That means the time that we lost because people were in the hospitals or they were sick at home, they couldn't work, they couldn't play, they couldn't enjoy life the best way they could because of those factors. So we're not just thinking and talking here about the impact on health and the health sector. We're talking about an impact that reaches entire society in different sectors. Even industry itself, I always mention that even industry that is producing harmful products is also suffering those losses because they are, they function based on people and they depend on the lives of those people that are working there too. So the whole work affects the whole society. And it's very important to recognize that these epidemics, they're not happening by chance. There's a whole architecture of products, practices, and policies that is put in place to fabricate those epidemics. And I'll be very brief. We know that ultra-processed food products are the ones that are leading the expansion of these epidemics in our region and in countries or regions where these are not growing so much. They're sustained at very high levels, sustaining that high impact, such as we have here, Canada, US, UK, for instance. So we know which products we're talking about, and we know that this is aligned with commercial practice. There is not that the fact that the products exist that is a problem. They are connected to commercial practices that include advertising, sponsorship, price and promotion, product placement in different settings such as schools and other settings, and the labeling of these products that make them expand their presence in the diets and in the food systems of our countries. And adding to the products, the practices, we have the policies. So the policies, the companies and corporate policies that attempt to shape government policies in ways that are favorable to the firm. We have this well documented for tobacco, alcohol, but also for ultra-processed companies that operate the same way, trying to frame these policies in their favor. So this combination is really what keeps and continues and sustains these epidemics in our region. And these slides, which is coming from a report that Jean-Claude was we're really thankful for Jean-Claude to help us in developing it, is tells us really well how the market deregulation is pursued by industry and why it is pursued by industry. Because here you see clearly that the more deregulated are the markets, the higher is the annual sales of per capita ultra-processed products in those countries. And this is based on an index of the Wall Street that measures the market regulation and data from 74 countries on the sales of ultra-processed products. And that means for us that if we do not regulate those products and those practices, we'll never be able, and then we'll speak about the policies as well, corporate policies, we're not going to be able to make any progress. There's no question about it. You know, if you can say, you know, let's do, and everything will help, education, all sorts of interventions or individual level might help. But the only thing that will work is to get those products, practices, and policies to be regulated. Then there's no way out of that. And I'll start with the labeling, because it's not that the labeling, even if we take examples from different policies and different unhealthy commodities like tobacco, labeling is usually not the one that recognizes the most cost-effective intervention to regulate those products. But for food products and drink products, it's really key because differently from other products, we need to have very clearly identified which products need to be regulated. And labeling is instrumental for us to identify those products clearly and then apply the other policies there may be even more restrictive and more effective, like taxation, like marketing restrictions. So I'll start with, and then settings like school and others. So looking at very quickly, and I'm going to go through some of the evidence that drove us in the region and evolved us from the first mandatory system we had in Mexico, which was this nutrition facts miniature. The GDA used portion sizes to define the percentages, and it was developed by industry, provided no information for the consumer. So that's where we started in the region. Then after the UK colored that GDA with traffic lights, Ecuador improved that a little bit from what the UK had and transformed the numbers into text and just left the text because we knew that the text was improving information and the numbers were complicating the information for consumers. But still, it was providing low, medium, high information. It was based on 100 grams, and we'll see what are the consequences for doing that. And then finally, we got the country that pioneered the use of warnings in our regions, which is Chile. The evidence at that moment was actually that the word should not be high in Spanish, it should read excess. But at the point that that evidence came out, the law was already passed and the regulation couldn't be changed. So in Chile, what we have is the word high, alto. And at that time, there wasn't a PAHO nutrient profile model, which was based and used the NOVA classification system attached to WHO intake goals. So they had to develop their own thresholds based on 100 grams. And finally, we've learned from every single element of those policies, everything that wasn't good and could be improved. And that's something that is really important. If we're thinking and if we're speaking about vaccines, for instance, we will always be trying to get something that is better than the previous one, or if we're thinking of any other solution. And I think the same way we need to think about policies that are trying to improve diets and public health in general. If we learn that something can be better, we have to evolve and we have to bring new countries to make it better. So industry was trying to move us, backwards, saying, let's repeat what we have, even the weaknesses of previous countries, and we're saying, no, we need to strengthen the weakened points that we are identifying in those countries. So we have now, after Chile, many countries have adopted warnings, and now we have Mexico with the warnings. It uses the word excess. Uruguay also used the word excess based on the evidence from Chile, also evidence from Uruguay. The basis of the thresholds are kilocalories, similar to what we have in the PAHO WHO nutrient profile model, because that's how recommendations of WHO are designed. There's no recommendation of WHO that's based on grams. They're all based on proportion of calories, specifically because the requirements of different populations are different. So that's why it was designed this way, so they can be a bit applicable to anywhere in the world. And Mexico and also Argentina, here we have the examples of warnings that was also approved in Argentina, went beyond and started to also include additives and warning for additives such as non-sugar sweeteners. It's also found in the PAHO nutrient profile model, for instance. So I'm gonna go quickly through the evidence, because one of the things that we identify is that, well, we need to have evidence that indicates to us that the systems has to be quick, has to be easy, has to be relevant and useful, and change intention and decision to purchase. So the pre-implementation studies that have been done in different countries, they looked into every single details of the design, which shape should be used, which color should be used, which mention, should we say, too much sugar, excess sugar, high in sugar. Everything was tested in all these countries and published in government reports or peer-reviewed journals, as you see on the left from Uruguay. So when we got the first, and you see here that the first proposal from Chile was to have excess in sugar, and then they couldn't come back to excess, and then we kept with the high. Also, evidence that we learned from Canadian studies, such as this one, identifying elements, important elements related to the size and to the position of the warning labels. For instance, we knew from tobacco evidence that the larger these warnings are, is a dose response to that. So the larger they are, the better is the response from consumers. And this study confirmed that. The other thing is, where should we place it? Does it make a difference if we put on the bottoms, if we put in the middle, if we put on the upper part, right, left-hand side? It does make a difference. And we are already using that information to build the new policies, using that information and get the best option for consumers. So when we started also comparing shapes, one of the things that the studies identified is when we compared the octagonal warning labels, which are multiple octagons, compared to one icon as the magnifying glass proposed here in Canada, is we would see a lower impact, and sometimes in this case here, the understanding about nutrient amounts wasn't significantly improved in the study that you see on your left-hand side. And other studies just compare the shape. Just if you use an octagonal shape, which is recognized as a warning sign or a warning icon versus a squared or rectangular, it would have a significant improvement just by taking the octagonal shape. So some studies that were even done assessing the brain activities, electroencephalograms outputs, that also told us more about the color, because there was at the beginning this understanding that if you move from GDA to a colored system, you improve interpretation, and that was true. If you move from something that has no information, that's just numbers in black and white, and you put colors, it will prove something. But there's more when colors and foods, they also connect some implicit associations that we make between those colors and foods. It's not by chance that some ultra-processed products use some specific colors there as their colors. And in these studies, and we've seen studies that both the green code of those systems can improve the perception and the misperception that a product is more healthy because it has a green color. On the other hand, the red color in such systems can also not have an undesirable effect, because the red in these studies specifically, when associated to sweet ultra-processed products, what these studies showed objectively, not asking their perception, but measuring their brain activities, that people will have a greater appetite for sweet products if they were associated with the red color. Maybe there's not by chance that a certain product we know is color like that. So we know since the 1970s, and this being awarded Nobel Prize of Economics in the 2002, a massive amount of evidence that have demonstrated that these systems have to be quick and easy. Consumers do not take a lot of time and cognitive effort in taking those decisions really quick, and for this reason, the system has to be quick, easy, and to help them taking that decision. So this is one example. I'm going to go through several studies that looked into those parameters. This is within subject randomized control trial done in Brazil, demonstrating that compared to multi-traffic lights, the warning labels were more trustworthy, helped more on their decision. They were more quick, they helped them to decide more quickly, and they were easier to understand. We also have studies, this is from Uruguay, measuring the time that people took to find the information and use that information. And you see how the warning has requires significantly less time to be located in the front of the package. And also, this is also to measure, it was done in Uruguay, to measure the relevance of the information. And what we want to see in this graph here is higher bars when we have nutrition information, and lower bars when we have cartoon characters and fruit drawing. We want fruit drawing, cartoon characters to be less relevant, and we want nutrition information to be more relevant. And that's exactly what we get here when we're looking at traffic light and warning system. When you have the warning system, cartoon characters, fruit drawings are less relevant, and in nutrition information are more relevant. So again, it meets our purpose. There's another study we've done in Brazil, and this uses the YAPS image, the International Affective Picture Systems. These images, they go from the right top hand side and they do this C curve. So on the right hand side, upper right hand side, you see the most positive and strong positive emotions. And on the left lower side, you see the strongest negative images related to that emotion, negative and strongly negative. So the first graph on the top, you see where ultra-processed products are very closely linked to the strongest positive emotions. And when we added the warnings, what happened is that all those black dots where the ultra-processed products were on the top, they were brought to a neutral valence. So if you see the faces here, the very happy face on the upper part, and you see that in the graph below, the black dots that were very concentrated, a strong positive association of ultra-processed products with very positive emotions, they were brought to a more neutral valence, to a more neutral emotion, which will allow consumers to probably choose their products less, let's say, emotionally, or use more their critical sense and the information and take an informed decision. We've done also a randomized control trial in Jamaica, comparing the control was just a nutrition upfront facts. Then we have the traffic lights, which is the one we have in the UK. The magnifying glass, which industry is sort of suggesting in the Caribbean. And then we have the warnings. And we wanted to, among other things, identify how the perception of healthfulness of those products were affected by the systems. All products have the same design, except for the front of pack labeling. And you see that the octagonal warning labels more than double the capacity of people perceiving those products that were not helpful as an unhelpful product. So, and we didn't have that effect found for traffic light and magnifying glass. When it comes to purchase intention, there was some effect from magnifying glass and reducing the purchase intention of those products, but for warning labels was far more superior there, the effect. There's one hypothesis that explains why there's this difference between a single icon versus a multiple icon system. As we know, there's a dose response in terms of how we occupy the surface of the front of the package. So in this case, we'll be sort of even because we're occupying more or less the same space. Maybe when we have on one icon, maybe the single icon may be occupying a little bit more, but more or less the same. When you start to add more nutrients, you start to increase the surface that you're occupying, and this is increasing the response of the consumers. If you have just a single icon, that's not going to change. And the other thing, if you have more nutrients and if you have additives, then you're going to occupy much more. And if you increase the size of those icons, then even more. So when you're comparing products that have 3 versus 2, it may be easier if you have multiple icons than you have one icon. We also, because we never go and test all the systems, and this is from Costa Rica, just to finalize that part, you see that, again, we compared these different systems. The only one we added now is we removed the magnifying glass. It was not a question in Costa Rica. And we added Nutri-Score, which is something that the industry was trying to push. And again, the warning labels double the likelihood of participants choosing to buy the least harmful option. And the other systems, Nutri-Score, GDA, traffic light, they were inefficacious. There's no difference from the control, which is having nothing. This meta-analysis already also demonstrating that it's not only the warning labels are efficacious, and these are all from experimental studies, pre-implementation studies, but the other systems, they cannot change that purchase intention. They may improve the information, but at the end, what we really want is to change purchase, and they're not being able to do that. So we know from pre-intervention studies and from these experimental design studies that the warning labels, they're quicker, easier, more relevant, more useful, and they have greater capacity to change intention, decision to purchase. So what are post-implementation studies show us? So we seen the first 6 months in Chile that more than 90% of the people were already influenced by that policy, and they were changing their decision somehow to a better decision. They were choosing foods with less icons, or they were choosing to not buy the product with a certain icon. And also in Peru, we saw reduction of sales of carbonated drinks and cookies, and this by 5%, 29%. This is the first 6 months. In Uruguay, a study that was done by University of Uruguay, 10 days after it was implemented, they were already in the supermarket doing the survey and identifying that more than half of the population was already affected that and changed their way they were purchasing. And in this study, they also used eye tracking. You see a person using eye tracking device that will track where people are actually looking. So it's not just asking them, it's really knowing where they're looking at. We know now from this study, this is the only real life study that we have in the world because it's been implemented mandatorily in the country, and it has proven to reduce the sales of products that are high in calories, sodium, saturated fats, and sugars. So we know not only from experimental data, but from real life data from the phase 1 of Chile implementation that the warnings can reduce the sales of the products where these icons and these warnings are found. And also we have the modeling studies that were done in Mexico, now adopting the warnings with the nutrient profile model as a threshold, estimating reductions on obesity around 15%, and also savings in US dollars at around 1.8 billion on obesity costs. So what are the things that we learned and taken on board for this specific policy? And now we'll come to the other policy and see how this is really critical for changing the entire food system. So the first lesson is how you put in the legislation of the countries where these icons should go. If you don't describe that correctly, for instance, if you just say, put in the front of the package, what is the front of the package here? This is one example of you cannot tell what is the front of the packet. I turned the middle package around, and there's the back of the package. So if you don't define precisely where it's going to be, industry will find a way to hide it. And this was in Ecuador. You see that in Ecuador, industry managed to put in the letter of the law that they could be allowed to put their front of pack label wherever they wanted to. So at the end, you never see unless you take the product and you twist it. And the same is happening even in countries that define it front, because now they can, especially on these sugary cereals, for instance, or saturated cereals. So now you see on the left-hand side is Peru. In Peru, you have to put on the right-hand side. So something that improved in terms of making mandatory the position that you have to put. Same thing here, position and size. This on the left-hand side, you see Chile. You know, it's on the bottom, almost going around, and it's smaller. So we're increasing the size every time we can, and we discuss with countries, can we make it a little bigger? So, and what is our parameter is to try to get at least 30% of the surface occupied by warnings. So in this case, we have it in upper hand side of, and they are much bigger. The other thing is what we would do in the case of Chile, and we're having a meeting next week actually in Chile to discuss what is the impact of reduction in sugar and how additives such as non-sugar sweeteners are increasing dramatically in the country. And this also poses a risk as we see the evidence evolving on the impact that non-sugar sweeteners have. So countries like Mexico, Argentina, and countries coming after Chile, learning from that experience, we need to also be precautious about that and add a precautionary label on non-nutritive non-sugar sweeteners, which is this example here, which in Chile would have no label. And I will explain why is this so important. The other thing we learned is that the products that have warnings, they decrease, but the products that do not have warnings, they increase. So as much important as defining which products have to have the warnings, it's really important to define which products won't have the warnings. It may be even more important because those products, they will increase. So you have to feel comfortable and have the evidence on your side and say, if we increase those products, we're gonna be fine. And that's why we say that the nutrient profile model has to be adopted as the gold standard for our region. Otherwise, you're gonna have products, and this is exactly the same product. And on your left, you have the product sold in France with a B score for Nutri-Score. It has 369 kilocalories. 27% of those kilocalories are coming from sugar, so 2.7 times higher than the recommendation. And on your right, you have the same product in Mexico without the cartoon character and with the warnings because it's taking the nutrient profile model of PAHO on board. And in this analysis that also Jean-Claude Moubarac and colleagues from the University of Montreal helped develop, we also assessed how what is the likelihood of people meeting WHO intake goals if they do not consume products that are excessive in sugars, fats, saturated fats, trans fats, and sodium, according to the PAHO nutrient profile. And you see that every time that the population did not consume these products that would be excessive, according to PAHO nutrient profile, they will have much higher 2 or 4, depending on the nutrients, times higher chances of meeting WHO intake goals. That means if we have the products with warnings based on the nutrient profile model, the other products that will go without it will probably be okay and help the population meeting the WHO intake goals. We know that licensed characters, and this I always like to show these examples, but there's many studies that have demonstrated what is being designed as a theory in the 70s. It's being proved over and over, which is the transfer sensation. If you change the label of the product, you can change the flavor, even the taste of the product. And in this study, you can see that you put the same product inside 2 boxes and you give to 3 children and you ask them how that product tastes. You're not asking them which they prefer, and they will say that the one that has the penguins has a better taste. So it does transfer sensation to the product just by changing the label. And that's what is also important when we're talking about from the product labeling. It's not about, and I always say, it's not about what you add, but even more about what you have to remove from the labels of these products, so you don't have such triggers. And that's the Santa Claus chocolate seen in Chile on the left before, and now how you see them on the shelves, and also other products that you would see a cartoon character there or something that is targeting at children, and you don't. The other thing that, so again, Mexico took that on board. We're removing cartoon characters, but something else that we also know that triggers consumers to perceive products as healthy, and these are the nutrient claims or health claims. So you see on the right-hand side that you had cartoon characters, and then you had a lot of claims about vitamins, energy, and on the left, you see them removing. And the reason why you had them in the first phase that it took some months for the cartoon characters, and in terms of the enforcement of cartoon characters and claims to be removed took a little bit, started a little bit later. So now we're not talking only about the cartoon characters that are focused at children, but also on the nutrient claims. And this is also many studies that can confirm that this was studied, and then you say, oh, this is just be for children, adults are not affected by that. This is a study done in Switzerland with adults. They just add the word fruit to the front of the pack, and they say fruit sugar, and then they improve the perception of people that that product is healthier just by adding the word fruit. And it's not just not even the image, just the fruit, just the word. And why, again, it's important for us to move beyond nutrients, again, as countries are moving into also warning about additives such as non-sugar sweeteners. What's happening with advertisement is the use of cross-promotion, which is well known from infant formulas. For those that are familiar with that world, where you put number 1 or number 2 and number 3, and they all look alike. And then this is being used in Chile, for instance, where you have very similar labels, and you can do the advertisement of the one that has no sugar and that has no warning. So you put a 0 sugar can of Coke in a big outdoor, and that's allowed because there's no sugar in there. But you're also cross-promoting the regular sugary version of that because they're so alike. And this is an example of alcohol. You cannot tell that this is a non-alcoholic beer, but it is. And then they will say, you know, we're not advertising, but you are advertising the alcoholic version as well as you cross-promoting those products. So the importance here of bringing those warnings for these additives is really important. Now, coming back to that example, industry in Mexico found a way around the legislation to, well, they did reduce the amount of sugar. And what we have now is that they removed the warnings. And I'll explain how this happened. Maybe I'll leave for later for the discussion because it may take more time. But what we have now between the French version and the Mexican version is that we have in France the same product. In France, that product has 27% of the calories from sugar, 100 kilocalories from sugar. And then you have 8% of the kilocalories from sugars in Mexico. So that's the other thing that companies claim for a long time. The nutrient profile model of PAHO is impossible to deal with, and they hate the nutrient profile model of PAHO, but they still were able to bring the amount of sugar down to lower than 10% of kilocalories from sugars. But I'll explain, and we're learning from that to not get a neutral processed product, to not have warnings and not have even a warning for non-sugar sweeteners. And I'll explain later how we're going to do that. So, and that has huge implications for marketing because the countries are using that to decide which products should not be advertised. So if they have a warning for non-sugar sweeteners or sugars or any other nutrients, they cannot advertise to children, or they have some specifications or restrictions for the market. So this is what we have for this product in Canada. You can advertise, you can even advertise and target them at children, which is what is this ad doing right now. When you go to Chile, if you're not advertising to children, you can advertise. And here is the first move that we're trying to change. This is something that was created by ultra-processed food industry that for some reason created this narrative that, yeah, for tobacco, we lost and children and adults cannot be exposed to advertising. But for ultra-processed products, I think adults should be, you know, we have the right to advertise to adults, and they will take it. They're grown-ups and they will understand the advertisement, and that suffices for us to justify that we have the right to stimulate the consumption of ultra-processed products to populations that have, you know, greatest prevalence of hypertension, diabetes, and should have these products reduced in their diets. So what we have in Chile is that they can, and they just have to add these sentences that say, prefer products with less warnings, which almost cannot see. It's on the top right-hand side here. When you go to Peru, what they decided, you have to put the warnings also on the advertisement. So there's a little bit of improvement here. but they still can do the advertising. They can even do the advertisement to children, given that they put the warnings. So we still need to work on that. And I think our next step is to try to break this discourse that only the advertisement that goes to children should be restricted, or advertising should just have the warnings and not be restricted for these different groups. So what we're trying to do, not only get specific legislations to restrict those markings of those products, but also use existing regulations that countries already have to sanction some of the advertisement that is already illegal based on the existing legislation. Legislation of consumer protection, legislation of children protection, legislation of misleading or unloyal competitiveness between companies. So this publication here, you can use this QR code and you assess the publication. Reports different cases where our countries told us there was use of existing legislation to find some of these companies. So in Colombia, the Mrs. Hen, the Doña Galinha, that was fined because the advertisement was generated false or mistake perception that the product was from Creole chicken, Creole hen, and it wasn't the case. So they were violating one of the laws. In Peru, there's these products that they used to have these pictures of fruits, but there's no fruit in the product. So it's, being the fine were not financially high, but in terms of the sanction was quite high because it asked and required the company to definitely and immediately terminate the advertisement and remove those images of fruits. In Brazil, it may happen, and there's many countries they do that. There's the McDonald's and the clown are going into the schools and using that as a theater play to do education with educational purpose. But this was again sanctioned as something that is illegal because abusive advertising, meaning advertising that goes direct at children, is considered abusive and then illegal. And they were also found to be in violation of the consumer protection legislation in Brazil. Schools, and then we'll close taxation. Very important that not only we restrict this universe of ultra-processed products in this school and other settings, meaning using also the public procurement power of public administered organizations and facilities that have the power to purchase and decide which foods they will buy or not buy. So making it as the basis, non and minimally processed foods. In many countries, this was not enough. They had also to ensure that within that non and minimally processed foods, we had a minimum of processed fruits and vegetables. And of course, always reminding water, this is still a huge problem in many countries where there's not access to water. And then not only thinking of the what, which product should be fed, which product should be supplied to the school, but how are we going to do that? So also favoring agroecological, family, indigenous, peasantry farming. This is all on the public procurement hands, all at the power of those that administer those facilities to legislate as well. And also develop resources and skills where needed. So there's places where it's not possible to build a new kitchen or rebuild the whole space. So how you think of different technologies, such as was thought in Colombia and in Bogota and in Peru, how you use cooking skills and structures that you have in the community so you can get that essential foods and meals for the children, and then how you build that demand and that re-enchantment for food of children, so you're not easing your competition as well against this the advertisement and the other aspects of the promotion of ultra-processed products that we need to regulate. And for that, there's been used not only the evidence, but a strong rights-based, and in the sense that many countries start to recognize that for you to fulfill the right to education, you have all these rights, they are interdependent. If you're not fulfilling the right to adequate food, you're not fulfilling the right to education. If you're speaking about a school setting, you're not fulfilling the right to health, you're not fulfilling the right to protection to children. So you can also make the case that you have to ensure that children have fulfill their right to adequate food in schools. There were many issues with monitoring enforcement, and again, how labeling is helping here. Countries like Uruguay starting to discuss from the pack labeling, not because it was the most effective way of getting people to reduce the consumption of those products, but because they didn't know how to monitor which products could go in and out of the school, or they should restrict. Now with the warnings, they say, no, this product, anyone can tell, cannot be here inside the school. So this is being very instrumental to the application of this policy. We have, for the consumption of sugar sweetened beverages, the most yellowish or orangish region in the world, meaning the ones that are consuming more sugar sweetened beverages in the region. And as we've shown in the report of PAHO in 2019, Jean-Claude also helped us with that too. You see that these sugar sweetened beverages make almost more than 70% of the free sugars of ultra-processed products. So they're providing and dumping more than 5 million tons of sugars in the food system themselves. And we see them then rising much more quickly than non-ultra-processed products. And we see the affordability, and this is the average annual percentage of change in real price of sugar sweetened beverages, reducing in most of our countries in the region and many other countries in other regions. There's a great affordability of those products rising up. And in these, I'm not going to go into the details, but this publication identifies how many countries have such taxation in place, but still a lot of improvement to make. And this is the most recent publications we've published in the Lancet. And it shows how much of the price of these sugar sweetened beverages in small and large containers are made of taxes. And the median excise taxes, which is really the tax that can have an effect on changing consumers' behavior. If you look at the amount of price, and this is what you see on the bottom here, the strongest blue tone here, this is what the share of the whole price is of excise tax, meaning for tobacco, so that you have an idea, it's recommended at least 70% of the price is made of taxes. And we're down below here with sugar sweetened beverages. So there's a lot of room to improve in terms of raising the taxation in the region. And we know it works. This is our best case in the region, and one of the best in the world, I could say the best in the world, to reduce the purchase of tax sugar sweetened beverages in Mexico. That was sustained for 2 years past, after the evaluation, and has been predicted to reduce obesity prevalence significantly as well. And we know from meta-analysis that also sweetened beverages have a great sickening power, and they increase the risk of obesity, diabetes, hypertension. So that's why we're looking ahead with countries and also looking at reducing the demand of sweetened beverages that are also those not sweetened with sugar only. We're thinking of the non-sugar sweetened beverages. And the killing power is really very similar. You see the relative risk of all-cause mortality on the left for sugar sweetened beverages, and for beverages sweetened without sugars, with all the non-sugar sweeteners, and it's very similar. So it's really important that we move our regulations towards that end. I'll close with the importance of having us having a systemic approach instead of the non-systemic approach. Is very often we see governments and policies and taking an approach that is just, so let's look how can we make this healthier, or how can we look this sustainable, or how can we look make it look more equitable? But we need all of them together. So we have to avoid situations where we are promoting ultra-processed products with organic ingredients, or we're because at the end of the line, we're gonna have those organic products captured by ultra-processed companies, and then we're gonna lose that consistency, that coherence between health, sustainability, and equity. The same thing if we're promoting fruits, vegetables, pulses, and this is concentrated in the hands of a very oligopolized markets. We're also not being promoting an equitable system. So we're again not being coherent with and the same thing with retail markets. So if we're having our supply system concentrated in these oligopolized markets of big surface supermarkets, we're not going to be able to generate a food system that is healthy, equitable, and sustainable. So that means that all that we spoke about, the need for regulation, goes for all these elements of the food system. If we're talking about how we produce and how we design and which products should be regulated, we can also look at how the production system. We can think of the supply system. We can think of the processing as well. And we see in the middle one example of many hands preparing real meals in an emergency, and one man destroying food to turn into ultra-processed product, for instance. Or not only the products, but the practices that are associated with healthy eating practice, as we see in the breastfeeding, against the use of a product that will monotonize and increase the risk of children with the infant formulas. Or the same with the monotonization with our diets in the ultra-processed versus the prepared meals. So I'll close with that sentence. That's the final part. That's even if when we start developing this work, the greatest barrier for us to advance in the countries is really that pressure that government, especially in countries where there's more difficult in backing up that influence from corporations. So it's really important. This is coming from the statement of the UN Rapporteur on Health, endorsed by other rapporteurs of the UN system, indicating that it's really important the governments can counter that influence. Otherwise, none of these policies will be, and this is the really critical point that prevent countries from moving forward. And we've recently launched this document that includes online tools that can help governments, Ministry of Health, in taking, at least thinking about their decision before they engage with non-state actors, especially commercial sectors. And this is available in Portuguese, Spanish, and English. And trying, we piloted that in different countries and helping, because most countries, they don't have a system on how to decide. So if a company just comes to the government and say, we're gonna offer you several refrigerators to help you with the vaccine. And depending on who is that company, what are the terms of the engagement? There's not a clear, specific system of how they decide if they're gonna go for that engagement or not. And this tool is helping them to make that reflection. So I'll stop here and leave you with a website. So this is in Spanish, but if you just type PAHO, PAHO.org/nutrition, you're gonna have much more information, evidence, questions, answers that might help and contribute somehow. And I'm happy to take comments, questions, and discuss it further. Sorry, it was a bit long.
Merci, thank you, Fabio, for this great and very colorful presentation. We have time now for questions. We can take questions in the room or from the chat room. So how do we go? Should I name the person? Florence?
Yes, hello. Thank you very much for this presentation. So it was really interesting. I just had a question about, the intervention that you are doing right now in schools. I was just wondering if they will also think about the weight stigma. Like when you have this kind of intervention, a little bit scared that if we don't also talk about the weight stigma, it might increase other problems. And in fact, when we are talking about children or adolescents, self-esteem about this can make, like, I don't know, other problems. So I was just wondering, what do you think about this, or is the PAOH is thinking about this when they are doing this intervention?
Yes, well, thank you very much for your question. I think the key there and what countries are pursuing in developing such policies in schools is that the whole focus is on the change of the environment and not change of the individuals. And that already have a huge impact on preventing such effects on mental health issues or other issues, social cultural issues that you were mentioning. So if the whole policy is about changing the environment and getting the environment to favor healthy foods, you don't even need to talk about obesity. You don't need to talk about that. But of course, if that's an issue, then it will be need to be dealt with. But what countries are focusing on is not on the individual changes, precisely to not generate these sort of issues, and focusing more on the changes of the environment, so everyone would be exposed to a healthy food environment in the schools, both preventing and eliminating, banning these products availability and promotion, and offering minimally processed cooked meals, and preferably coming from small-scale agroecological farmers.
Okay, thank you very much. But it just, like, for example, when we saw the ads of the, what was the name already? miescuelasaludable.org, we saw like this little girl, not kind of good weight and all. I'm just scared that for the, if we want to put intervention just to show the diversity that it can, you can choose vegetables or fruits even if you are overweight. Just this little thing to say.
Excellent point. Yeah, that image comes from Mexico, from an NGO that is leading the advocacy against obesity prevention. And the focus of that was really on getting junk food and schools free from junk food. But I see your point, that is this how they depict that. So the initiative is not about reducing obesity. It's about getting the school rid of junk food. But I understand your point, and I'll be happy to share with them the idea of making the images that they're using, even for keeping their focus on getting the schools rid of junk food, to better depict different a diversity of children that are found and are living in the school, so they can identify themselves as part of the food community.
Thank you so much. Thank you.
Merci Florence. Donc, on peut poursuivre avec des questions. Ça peut être en français ou en anglais. Donc, on a une question ici de la salle.
Thank you very much first for your presentation. Maybe do you want me to?
Tu peux enlever ton masque pour poser la question.
Thank you. So yeah, I saw a French documentary about a Mexican putting in place these labeling regulations. And in Mexican school, they were teaching children these labeling regulations, what it means, how these products can harm their body. And so the documentary was telling that the children was really interesting and learning this level regulation, and they have great impact on their choosing the right projects and on their parents too. So did you see an intergenerational impact or like this, or a great impact of educating children about this level of regulations?
Yeah, there is evidence from Chile.
Yeah.
That there is intergenerational impact. There are qualitative studies that have been published in peer-reviewed journals, and I can share them with you. And they have identified how children have influenced their parents in their decisions. Okay. The other thing is that because the way warnings are designed they're so simple, it's also been demonstrated that even young children, they already understand it. And that was also a question that emerged in different countries where there was a high level of illiteracy. They would say, will it still work because it's a warning, and do I have to read? But because it's so simple and it's a warning icon, people and even children, they will just recognize that icon and they will associate, the more you have, the worse it is. So both, yes, there's evidence that it works for children because of its simplicity, and it does generate these effects. And also, if we take a previous evidence on intergenerational effect, we know that children, especially young ones, they also tend to repeat the purchase behavior. So there's some studies done in the US that they send children with money to buy to make their own groceries, and they will sort of repeat depending on their age group. So there's both way, because parents are exposed and children are exposed, and there's a two-way impact, positive impact, like a virtual cycle of interaction between both, I'd say. Yeah.
Thank you.
Merci. Moi, j'ai peut-être une petite question. Just, can you speak about how well we're doing in Canada in terms of our food policies compared to the region?
Yeah, so the proposal in terms of the regulations, we know, and I don't have much information on which is the step now, but Health Canada did a consultation on front of pack labeling, and this uses a high-end one icon system based on evidence from different countries. In experimental and post implementation, it works not as effective as the multiple icons, but this could be compensated, for instance, by the size. If you have a good size and you're occupying a good percentage of that surface, that may help. And I know they're working on regulating, and one of the things that are really important, that's from the pack labeling, from marketing, what I can tell is that Canada has been one of the few countries from the north, I would say, that is looking into successful experiences in Latin America. And they're really listening there. Since from the pack labeling discussions, they're very interested in the Chilean experience. They're reaching out and trying to understand how is the enforcement happening for marketing regulations. I mean, we're still lacking a decision and getting that implemented, and that's of course always beyond our reach. And we know there's a lot of changes in the past years since the consultation took place. So I think that compared to Latin America, as other countries in the North, it's still far from getting a better regulatory framework to protect healthy diets. But they're seeing and they're looking at it and they're learning from it, and that's the impression I have.
We listen, we observe, we take our time. Bella, you have a question?
First of all, thank you so much for this very insightful presentation. I have one question and one clarification to ask you. I'll start with the clarification. The example that you gave where you showed that they took off the cartoons and all of that for marketing for children, and the nutrient claims where you showed like the vitamin example that was taken off, is that only in the case where there's a warning label, or is it the case for all foods?
No, only when there's a warning. And the argument is the following. If the product is high in sugar, it doesn't matter it has vitamins, because vitamins will not prevent you from obesity and diabetes. Absolutely. So you have to be coherent.
And does that apply to all foods or only foods marketed to children?
All foods.
Okay, great.
All processed and ultra-processed.
Right. So my question is, you actually read my mind, and your last slide was about it. We've seen how the industry tends to partner with governments and the way they form allyship with governments and influence policymaking in many countries. And this is very well documented in the Americas. So my question is, and I will definitely be reading that roadmap that you told us about. My question is if you've seen it happening where public health was proposing one thing and then it was proposing another thing, and how we're able to sort of tip the balance towards health, because we've seen that the counter argument is always, I mean, our argument is health, but then there's a counter argument where there's economy and jobs being created from industry, right? Which is tobacco right now, food, and it's very powerful as a counter argument for governments. As soon as you speak economy, then all the sensors go on. So I'm just curious to know if you dealt with that kind of situation, and I'd be really happy to know if there was any success story.
Every day I deal with that every day. So and there's many successful stories. It takes time, but there are many. So you have to deal with every single counter argument: economics, legal, international trade, and we have them all on our side. We have all the arguments on our side. If we look at the economic impact, you never find a cost-benefit analysis, and you never find an example where having the expansion of ultra-processed products in the countries to be more beneficial than the other way around. So we, but again, you always have to be context specific. And I'll cite one example. So we have peer-reviewed, papers demonstrating that the warning labels in Chile, actually there are two, did not generate any job losses nor changes in wages for employees. And so you have the theory behind. First, economies are dynamic. When you don't spend money on something, the money doesn't fly from the country. It goes somewhere else. So what did we do? We did when we started dealing with these arguments. First thing I did was I went to the annual report of printing and labeling companies in Chile, skyrocketing employments and extra payment for them to cope with the demand of relabeling and redesigning. But then we had economists doing formal econometric analysis and showing there's no job losses, not even in the affected company, nor in the overall company. We also had evidence from taxation. It didn't change jobs in Mexico. It didn't change jobs in US jurisdictions that took that. So we could say that even for more restrictive policies, we didn't generate that, neither for the affected companies nor for the general. Then when we use the example of Chile in Argentina, they say, oh, but that's Chile, and Chile is not the sugarcane production. We are sugarcane production. So when we had to study the sugarcane production sector, and we found out the sugarcane production sector was already moving into biofuels and alcohol and sanitizers for COVID. And then we approved the law. And we approved the law in Argentina in the middle of the COVID pandemic. Because so we had to deal with each of, you cannot leave any of them unresponded. You have to. And Argentina is an example. It starts with a 5-year work and debate and insisting and not always going for more than you want to get, so you can get where you are. And then the final struggle was 12 hours of discussion in the Congress until we get it approved, and we got it an anonymous approval.
Congratulations.
Yeah.
Thank you. Maybe we have time for one more question in the room because it's Friday afternoon. It's super interesting, but I think we need to leave the room at some point. So Anna, if you want to.
Thank you. Nice to see you here. My question is, who is keeping the industry accountable on a country-by-country basis to check if they're implementing the warning labels correctly? So, the ministries of health, are we relying on NGOs?
Yeah, and the authorities that enforce warning labels, marketing, advertising, they vary in different countries, but usually the Minister of Health is in charge of implementing, also monitoring. Sometimes it's shared with ministries of consumer protection defense or ministries of justice, or which are linked to consumer defense protection systems in the country. But usually, yes, the health authority takes the lead in doing that. I suspect that in Canada, you have Health Canada and food inspection, which is, I believe it's also within Health Canada. So yes, usually there are structures within the Ministry of Health and sometimes other ministries that will do that. If it's taxation, then you go to Ministry of Finance. If it's schools, it's Ministry of Education. And then you have the layers of jurisdictions. So you may have for schools, municipal, state jurisdictions that have a role. And even at school level, the community also have a role in monitoring, for instance, for schools. They have to approve the budget. They have to approve that the money was spent with foods that are allowed for the school to spend on. So yeah, there's depending on the policies, there are multiple systems that are used. In the case of the warrants, usually the Minister of Health takes the lead.
Great. Well, merci beaucoup. Thank you, Fabio. Thank you for everybody here, everybody virtually participating. And hopefully next time you come, all of these policies will be implemented here in Canada. And so I thank you for this message of hope and all great presentation you shared with us. So,
thank you.
Thank you. And j'invite les gens à regarder la programmation du CReSP à venir. Il y a des conférences très riches et diversifiées qui s'en viennent. Donc, sur le site du CReSP.ca. Et voilà, bonne fin de semaine tout le monde. Merci.
Merci.
Yes, it will be on YouTube.